Okay, I like to do the mandibular anterior chords in a way. So I'm going to sit at 9 o'clock for the chords. So if I had just done the quadrant, I'm going to continue doing all the chord surfaces. So I'll just pick a tooth and do a chord surface. I'm using the face of my instrument. My tip is not, or my terminal center is not touching the tooth. It's adapted onto the anterior third. So I am up. I'm standing up on the tip to get that adapted. So I'm going to go ahead and start using the face, sweeping stroke, and working my way down into that hole. Make sure I get all the way down into that hole. Now, the anterior teeth are a little bit shorter, so sometimes when you are in here and you come up under the contact, your tip, so the lingual side, you're going to see the tip coming through. You want to make sure the tip is adapted to the tooth still. So if you're coming through, but it looks like this, it's in the middle, it's not adapted. It should be adapted to the tooth coming through so that you're not infected, and then come up under the contact. You got to still keep it on, getting all this area here. Okay, and then continue around the line angle. Again, take a look at how my tip is adapted using the lateral side, and I'm going to stop. I'm going to kind of do the whole buccal side and then stop and move on to the next tooth. So same thing, left face, working my way in, all the way into the hole, and then up, and then out here, all the way to buccal, and then on to the next tooth, just like that. So lingual, and then I'm going to do the lingual surfaces chords. So I don't want to move around too much. I'm still at my 9 o'clock position, and I'm going to do the surfaces chords. This time I'm going to start on this line angle. Again, I'm on the face of my instrument, working my way in, and all the way down. And again, if I find calculus, I tap down. Take a look at how far away my terminal center is, and all the way down into that hole, and then follow up by sweeping. And then drop and get the tip to come under the contact. And again, if it comes through to the other side, make sure it's adapted. Okay? It's always good to do the buccal first and then the lingual. Now I'm going to do the straight lingual. I can use the lateral side. If I'm having trouble and it's not coming off, I can turn to use the face of my instrument. Okay? And tap down on the calculus and then sweep. Follow. Always follow up with a sweep. If I still feel it, I'm going to tap on it. I can tap on it from the side, one side and the other, and tap down and sweep. Okay. So I'm going to do all the surfaces chords, and then I'll move away to my away position, and I will go to 11 to 1. Sorry. Let me pull this closer. And I want my cord closer. So now I'm going to do all the away. So again, I'm going to start on the buccal side first. And my sextant can go on the lingual. If there's no lip in my way, I can go on the lingual. If there's a lip and I really need to retract it, I can use the suction, or I can just use my fingers. So I can kind of hold the suction and hold the lip at the same time like this, modify it. So again, starting with the surface away on the face of the instrument, and coming around the line angle and into the medial for this tooth, and all the way down into the hole, trying to stay on the face of my instrument. Okay, and then drop and come up under the contact, and then follow up by doing the buccal side using the lateral side and the face. Stay adapted. And then I'm going to do all the surfaces away, and then I will do all the surfaces away on the lingual. Same thing. You know, come up from, see if you can show from up top. And line angle. And then all the way down into that hole, and it's way deeper than you think. And if you're coming across, you should stay adapted to the tooth. So, sweeping, finding calculus, applying a little bit of tapping motion, and then follow up into that hole, come out, and then using the face again for the direct lingual, and doing all the surfaces away. Okay. And let's stop and move on to the